Marsh, and today I'm going to demonstrate how to do a wet to dry sterile dressing change. So the first thing I'm going to want to do is gather all of my supplies. So I'm going to want a biohazard bag, a cup to put my normal saline that's sterile in, some tape, my ABD, some gauze, and then some sterile gloves and a measuring cup, as well as some cotton tip applicators. So the first thing I'm going to do for my hand hygiene, I'm going to walk into my patient's room and I'm going to identify my patient with two patient identifiers. Hi, Mr. Jones. My name is Catherine. Today I'm going to be your nurse. I'm going to change the dressing on your abdomen. Could you please tell me your name and date of birth? I would then verify it with his wristband. I would also ask him if he has any allergies to latex or any tape. And then I would assess his comfort. So I'd ask him if he's in any pain. I'd then ask him if he experienced any pain on his previous dressing changes. And if so, as he rates it on a scale of 1 to 10 for me, I would want to provide him with an analgesic at least 30 minutes prior to this dressing change. So the first thing I'm going to do is adjust everything to a comfortable working height. So I'm going to raise this bed up to waist level for me. And then I'm going to put down the sidewalls so I can reach. Provide proper hand washing technique. I'm going to get my biohazard bag ready. And I want to put this in a place where it'll be accessible. Go ahead and expose just his abdomen for privacy. And then I'm going to put on some clean gloves. And I'm going to note that the last nurse actually included the last date of the dressing change and the time. I'm going to remove the tape in the direction of the dressing so to not to put any pressure on the incision. I'm going to discard this. I'm going to remove my 4x4 gauze, and I'm going to look for any drainage present and note that. So the purpose of wet to dry sterile dressing change is for debridement. So it's cleaning the wound. So I want to make sure that this gauze is clean, is dry, otherwise I can't remove it. So I want to be really careful when I am removing it so that in case it is stuck to some of the tissue down below, I'm not pulling on it too much. So I'm going to remove it. And then I'm going to assess my gauze. I'm going to assess for the type of drainage present, whether it's serous, sanguinous, or purulent. I'm going to note the amount of drainage present, and then I'm also going to note whether or not there's an odor present. Then I'm going to go ahead and remove my gloves, dispose of them. I'm also going to assess the wound. So I'm going to look at the edges of the wound for color, any drainage present. I'm going to look inside the wound, and I'm going to assess all that information because I'm going to want to document it. I'm going to provide my hand washing technique, and now I'm ready to set up my sterile field. So I've already set up my cotton tip applicators on the side so that they'll be accessible. I'm going to get my sterile normal saline ready. And I'm going to pretend that this bottle has not been opened before. If it had been opened before, it's only good for 24 hours. So you want to note if it's been opened before. If it had been opened, I just want to do what's called lipping, which means I pour off a little bit of my solution into my biohazard bag. So that way it cleans the inside of the neck here, so that way I know that I'm using sterile saline. When I remove the lid, I want to put it face down so that I don't contaminate the top of it because it's going back on this bottle. When I go to put a port in here, I want to make sure that my hand is covering the label because I don't want to spill any on the label because it can mess up the label and the next person that goes to use this might not know what it is. So I'm going to pour some in here. Put my lid back on. I would then label this bottle, and it's only good for 24 hours from now. Alright. Now I can go ahead and set up my sterile fill here. So I'm going to open up my packages. I can touch an inch border around them. I don't want to touch inside any of this because it is sterile and I would break my sterile filled. So I'm going to open it up, making sure I'm not reaching over my sterile fill. I'm going to open up my gauze packets. And then I want to look at all my packaging and make sure it's within the required date and that it's not expired. So I'm going to open up my gloves and throw this away because I don't need it anymore. And it's okay if I touch this packaging because the gloves inside are sterile, the outside of this is not sterile. On my packaging it also tells me which is the right glove and which is the left one. So just to be on the safe side, I'm going to use my hand sanitizer again. Alright, I can go ahead and open up this packaging. Being careful not to contaminate any of my others. First thing I'd want to do is to glove up my dominant hand first. So I'm going to use my thumb and pointer finger of my left hand, and I'm only going to be touching the inside of this glove. I'm going to step back a little bit to make sure that the fingers of this glove do not touch anything and break my sterile filled. Now I'm ready to glove my other hand. This hand is sterile, so I have to be careful where I touch. So I only want to touch sterile to sterile. So I'm going to touch inside of here. Step back. And I'm going to be careful where I'm touching. I can only touch inside here. I'm going to put my hands together. And now I'm ready to dress my wound. The first thing I'm going to do is clean my wound. I'm going to take a cotton applicator, dip it in my sterile, normal saline, and I'm going to clean the wound from least contaminated to most contaminated. So I'm going from clean to dirty. So I'm going to clean around the edge of this wound. Dispose of this. I'm going to get a new one. And then my saline again. Clean around this edge this whole time, making sure not to put my back to my sterile fill. Otherwise I have to start all over. Then I'm going to clean inside the wound. I'm also going to be looking for any tunneling or undermining in the wound. Dispose of this. Alright, and now I'm ready to get my packing material ready. So I'm going to take my 4x4 gauze. I'm going to pull it apart. And I'm going to place this in my normal saline, being careful not for it to touch any of the container, because I don't want to contaminate it. Get another one. Open it up. This whole time making sure nothing goes below my waist. Carefully put that in there. So before I go and pack my wound, I'm going to measure my wound. So I'm going to take a cotton applicator and I'm going to be carefully measuring length and the width from the widest part as well as the depth of the wound. And then I would record that measurement in centimeters in my documentation. Alright, now I'm ready to pack my wound. So, without touching this cup, I'm going to wring out my gauze. And it's important that you wring them out really thoroughly because that is the whole purpose to the wet to dry method, is you don't want it super damp inside your wound because you want it to dry so that it does clean and debride the wound. I'm going to take my cotton applicator. I'm going to pack. If there was any tunneling or undermining, I would pack that first. I'm going to carefully pack it, making sure that none of the gauze touches the outside skin, but that it comes in contact with everything inside. Get my other gauze. Careful not to touch my cup. And wring it out really thoroughly. Don't want to pack this too tight because then I'll put too much pressure on the wound. So I'm going to pack it. Now I'm ready to take my 4x4 gauze and put on top. And then I'm ready for my ABD. So when I remove my ABD, I want to make sure it doesn't touch anything, that it remains sterile. And we're going to put the blue on top. Place this over it. Alright, now I can go ahead and remove my sterile gloves because I'm not going to be needing them any longer. I'm going to go ahead and tape the wound. It's easier to do this without gloves. Last thing I'm going to do here is just take a little piece and I'm going to write my initials on it, put today's date, and I'm going to go a step further and even put the exact time. And I'm going to put this on my dressing change so the next nurse knows when I changed it. I'm going to remove this. To cover him back up. Put my side rail back up. I'm going to adjust the bed back down to a lower level. And I'm then going to ask Mr. Jones what his pain level was like, because I want to know his pain level prior to this procedure, during the procedure, and then what his pain level is right now so that I can document that for future dressing changes. And that's how you do a wet to dry sterile dressing change.